Welcome to Zevia Weight Loss and Med Spa. You know, if you've been living around an injury, modifying your workouts, always favoring one side, sleeping on your good side, you know that frustrating feeling. You've done the PT, you've rested, maybe you even tried a cortisone shot, and it just won't fully resolve. It gets a little better, then it comes right back. That's so common, and listen, it's not a motivation problem. These are usually the most disciplined people. The issue is actually biological. Your tendons and ligaments, they're among the poorest vascularized structures in your entire body. So without adequate blood supply, all those repair signals just can't get to where they need to go. And that's exactly why this combination is so interesting. It's BPC-57 and TB-500, often called the Wolverine Blend. It's a precision combination of two regenerative peptides that attacks that recovery bottleneck from two completely different directions. So let's talk about what's actually happening when an injury just won't heal. As we said, tendons and ligaments have inherently poor blood supply. They're what we call hypovascular structures. Your body is sending out repair signals, but it's like having a fire department with no roads to get to the fire. The cells that need to get there simply can't arrive in sufficient numbers. And this is an incredibly common problem. Just look at the numbers. Over 30% of all sports injuries involve tendons, and chronic tendinopathy, that affects up to 50% of athletes over 40. So if this sounds like you are definitely not alone. And the numbers on the other side tell an incredible story too. In a retrospective study of patients who got this combined therapy, 87.5% reported significant pain relief. I mean, that's a remarkable response rate, especially for a group of people with chronic treatment-resistant pain. Okay, so let's get into it. How it works. First up is BPC-157. This peptide is derived from a protective protein found in human gastric juice. Its main job here is to build new blood vessels, a process called angiogenesis. It does this by upregulating something called VEGF2, which kicks off a whole signaling cascade for healing. So it's solving that transportation infrastructure problem. It's literally building new roads, new highways to the injury site. Exactly. And it doesn't just build the roads. It also creates docking stations for the repair cells once they arrive. But here's the really remarkable part. BPC-157 upregulates growth hormone receptors up to 7-fold in tendon fibroblasts. Now, since growth hormone peaks during deep sleep, this is basically priming your tissues to respond dramatically better to the repair hormones your body naturally produces while you sleep. Now let's talk about TB-500. This is the synthetic version of a molecule called thymosin beta-4, and it works through a completely different mechanism. It's the body's main molecule for controlling actin. Those are the cellular building blocks. And because it's so small, it can travel long distances through your tissues, reaching injury sites all over the body. And this is where the beautiful synergy comes in. BPC-157 increases the raw materials, the actin, and builds the vascular infrastructure. We call it the architect. Then, TB-500, the mobilizer, manages the logistics of deploying that workforce precisely where it's needing. And on top of that, their strengths are complementary. BPC-157 is strongest in tendons, ligaments, and gut tissue. TB-500 really shines in muscle and soft tissue. So when you combine them, you get this full spectrum coverage that neither peptide could ever achieve on its own. So how is this all administered? It's done with a subcutaneous injection using a very fine insulin needle, and it's self-administered at home. BPC-157 gets absorbed and starts working within just a few minutes, while TB-500 hits its peak in about 30 to 60 minutes. Let's talk about the timeline. We call the first phase, from days 1 through 14, the opening. BPC-157's gene expression cascades activate within 10 minutes of your very first injection. And within that first week, most people notice subtle but very real shifts, maybe less morning stiffness or reduced sharpness of pain. Then you move into the building momentum phase, from weeks 2 to 6. This is where that dual pathway approach really starts to show. You'll see the earliest improvements in tendons and ligaments, and TB-500 systemic effects start to kick in. For acute injuries, this is often where you can see some really substantial resolution. And finally, we have the crescendo, from weeks 6 to 12 and beyond. This is the peak therapeutic window for most conditions, especially chronic ones. But what's so important is that the cascading cellular processes continue on their own after you complete the protocol. Some patients maintain that relief for 6 months or even longer. Okay,
So a great question we always get is, what can someone do alongside their protocol to really amplify these results?
Well, first, nutrition is key. Vitamin C is absolutely critical here. Both peptides accelerate collagen deposition, but without enough vitamin C, the new collagen just won't have the right structural integrity. On top of that, things like collagen peptides and making sure you have adequate protein just give your body all the raw materials it needs for this accelerated repair. And sleep is huge for this protocol specifically, right? Because of that growth hormone connection. Remember, BPC-157 upregulates those receptors up to sevenfold, but that priming only pays off when growth hormone is actually available, which peaks during deep sleep. So getting 7 to 9 hours of consistent, quality sleep might be the single most important lifestyle factor here. Now, the subcutaneous delivery is interesting because there's also a strategy component to it. Your Zivia provider will actually guide you on injecting near the injury site for those localized BPC-157 effects versus, say, an abdominal injection for the systemic TB-500 distribution. And this is exactly why having a team like Zivia matters so much. You're combining two different peptides with different half-lives, different tissue affinities, and a really specific dose-response curve, especially on BPC-157, where more is not always better. This is not a take-and-wait protocol. Your Zia provider calibrates that dosing ratio and makes adjustments throughout your cycle. And that's really the difference between precision therapeutics and just a generic recommendation you might find online. It's having a team that's genuinely watching, adjusting your protocol, and making sure everything is optimized for you. So if you've been living around an injury and you're ready to explore what's actually possible, well, this all starts with a conversation. Your Zivia provider will evaluate your specific situation, your injury history, your recovery goals, and then build a protocol around your biology. It's about your body, your goals, and a team that's genuinely invested in getting you back to what you love doing. To get started, just visit Zivia.com. That's ZVI.com, or you can call the number on your screen, 303-902-5353, to schedule your consultation with the Zivia team today. And just a reminder, this is educational information. Your Zivia provider will work with you to determine if this protocol is appropriate for your individual needs. Thanks so much for watching.